Hello everyone, welcome to MedDevice. In this video, we're gonna be looking at Chiari syndrome. So let's start. So what exactly is this syndrome? So it is a very rare condition which affects about 1 million adults. What happens in this condition? There is obstruction of the major hepatic veins which leads to this syndrome. And it is characterized by liver enlargement, pain and ascites. So with this background in mind, let's see what the causes are. So any disorder which can lead to an increase in the formation of a thrombus can lead to this syndrome. So examples of such conditions include polycythemia vera, where there is an increased amount of RBC, so there is an increased chance of getting a thrombus, paroxysmal nocturnal hemoglobinuria, and deficiencies in antithrombin 3 and protein CNS. These conditions increase the chances of thrombus formation. Postpartum and OCP use can also lead to a hypercoagulable state. Now, if there is not a thrombus but there is some condition which is leading to the compression of the veins, it can lead to this syndrome also. For example, tumors such as hepatocellular carcinoma or even hydrated cysts can lead to this. Other conditions include congenital venous webs and antiphospholipid antibody syndrome. So let's see what exactly happens here. So here you can see the left hepatic vein, the right hepatic vein and the middle hepatic vein. All of these drain into the IVC. So if there is a formation of thrombus in any of these locations, the blood will not be able to go from the hepatic veins into the IVC, and this will lead to the symptoms. So what symptoms will be seen here? So there is a triad which we already saw in the start, which includes hepatomegaly, ascites and right upper quadrant pain. Why is ascites seen here? This is because blood is not able to go through from the veins into the IVC. This leads to an increase in the hydrostatic pressure in the veins, which will lead to ascites. Other than that, we can see centrilobular necrosis, and this is an important pathology question to remember. There will be jaundice, and if there is a thrombus in the inferior vena cava, we will even see peripheral edema. Finally, if the patient does not seek treatment, this condition can lead to cirrhosis. Now, sparing of caudate lobe is seen here. What do I mean by this? So the liver has different lobes, right? So there is a caudate lobe which has its own venous drainage. It drains directly into the inferior vena cava. And so you tell me, if there is a thrombus in the left or right hepatic veins, what is going to happen to the caudate lobe? Is it going to be affected? Not really. The other lobes are going to be affected, and we are going to see a compensatory enlargement of the caudate lobe, because in a way the caudate lobe takes over the work of the other lobes which are not working. How are you going to diagnose this condition? So we can do liver function tests where the findings will be very similar to viral hepatitis. We will see increased serum bilirubin, increased SGOT and SGPT. We can even do ultrasonography with Doppler, which will show hepatic vein obliteration. Another very important point to remember is that in ascitic fluid analysis, the protein level will be more than 2.5 grams per deciliter in the early stages. This can be given as a very important hint in the MCQs. Apart from this, we can do CT and MRI, which will show caudate lobe enlargement. But if they are asking the investigation of choice, this is a hepatic venography. Finally, how are you going to treat this condition? So we will have to give long-term anticoagulation drugs, and in certain cases we can do balloon angioplasty. Balloon angioplasty is a procedure where a tiny balloon is guided through the artery to the blockage and then it is inflated so that the blood flow can be restored. Both of these are done in acute Chiari syndrome. We can even do surgical shunts or finally orthoptic liver transplantation. Both of these are done in chronic Chiari syndrome. So you will have to answer according to the question. That's it for this video. If you have any doubts, so please leave them in the comments or you can message me on Instagram anytime. The link to my Instagram is in the description. Thank you.